Welcome to the 2015 General Compliance Training. The General Compliance Training provides an overview of the Kindred Compliance Program and emphasizes the importance of acting with integrity. At Kindred, you are expected to conduct your behavior in a way that is legal and ethical and complies with the law. This training is designed to make you aware of laws and regulations that affect how you do your job and how you are responsible for compliance with state and federal laws. You are required to complete this general compliance training annually. In addition to this general compliance training, you may be required to take additional annual role-based training. Role-based training focuses on information that an employee needs to perform job responsibilities properly. Clinical employees who provide direct patient care must complete 5 hours of role-based training annually. Financial employees involved in the preparation or submission of claims for reimbursement or cost reports, and those with coding responsibilities must complete 3 hours of role-based training annually. Clinical or financial employees who supervise, make staffing decisions, set policy and procedure, or are responsible for quality assurance and improvement must complete 3 hours of role-based training annually. Your division's representatives are responsible for implementing this training. Compliance means conducting your actions within the ethical and legal obligations required of all of us at Kindred. Kindred's compliance program is designed to help all employees and contractors conduct business appropriately and in compliance with policies and procedures, provide a way to report concerns regarding improper behavior, help outline how and when Kindred responds to concerns, and help to detect and prevent fraud. Kindred's compliance program requires you to report any concerns you have about improper behavior. Concerns, complaints, and potential violations of the code or other company policies may be reported to the Chief Compliance Officer or to the Compliance Department in various ways. By mail, send to Kindred Healthcare, 680 South 4th Avenue, Louisville, Kentucky 40202. Attention Chief Compliance Officer. By emailing web_administrator@kindred.com. By calling the Compliance Hotline at 800-359-7412, or by reporting the concern directly to the Chief Compliance Officer or to a member of the Compliance Department. Kindred has established a corporate compliance program based on the federal sentencing guidelines to monitor our business practices. Kindred has designated a compliance officer and a compliance committee to oversee the compliance program. The compliance officer is responsible for overseeing Kindred's compliance with statutes, rules, regulations, and policies. The compliance committee is an extension of the compliance officer and provides Kindred with increased oversight. Kindred maintains a corporate compliance program through policies and procedures that help prevent fraud, waste, and abuse, enhance operational functions, and improve the quality of health services. Kindred has developed and implemented internal controls and procedures that promote compliance with statutes and regulations of the federal and state healthcare programs and other accrediting or certification entities. It is important for you to be familiar with your division's policies and procedures related to fraud, waste, and abuse. Kindred provides care to patients who are covered under the Medicare and Medicaid programs. Because Kindred accepts payments from the Medicare and Medicaid programs, Kindred must follow specific rules regarding how patients are cared for, how services are billed, and how records are kept. We all take responsibility for making sure our patients receive the best care possible. We work ethically, provide high-quality service, and submit claims for payment only when services are medically necessary and have been provided and appropriately documented. The public and the government place trust in the healthcare industry to provide patients with only services that are necessary and to bill those services accurately. In order to ensure that healthcare companies comply with these obligations, the government has enacted laws to prevent healthcare fraud and abuse. An example of important fraud and abuse laws that apply to Kindred are the False Claims Act, the Deficit Reduction Act, the Anti-Kickback Statute, the Physician Self-Referral Law, the Exclusion Authorities, and the Civil Monetary Penalties Law. Kindred Nursing Center and hospice employees must adhere to the Elder Justice Act. We will discuss these laws and how we comply with them. In addition to the laws designed to prevent healthcare fraud and abuse, we will discuss patient privacy, including HIPAA, and how you must make sure that patient information is protected from unauthorized use and disclosure. There are state laws that also must be followed. If you have questions about specific states, contact the law department. As a member of the Kindred team, it is your obligation to comply with Kindred's compliance program and the Code of Conduct. We will discuss the structure of Kindred's compliance program and the obligations that you have to report potential or actual compliance concerns. Kindred's Code of Conduct is the foundation of Kindred's compliance program. The Code of Conduct details Kindred's values, provides basic legal principles, and educates employees and contractors on how to respond when you discover practices that you believe may violate the code. Every employee and contractor is expected to comply with the Code of Conduct. The Code of Conduct is provided to all employees and covered contractors. You are responsible for making sure you have received, read, and will follow the Code of Conduct each year. The legal and compliance principles in the Code of Conduct are the ways in which Kindred employees must act in order to make sure they are complying with the law. Federal law requires employees to refrain from acting in ways that could make someone question whether they have the best interests of a patient in mind when making decisions. In order for Kindred's compliance program to be successful, you must take an active role in following Kindred policy and the Code of Conduct. Part of your annual evaluation is whether or not you have been compliant with different aspects of Kindred's compliance program. Failing to follow Kindred policy, including reporting instances of wrongdoing, can result in serious consequences, ranging from verbal warnings to suspension to termination of employment. In addition to disciplinary action by Kindred, failure to follow Kindred policy may lead to violations of state or federal laws. The False Claims Act, the Anti-Kickback Statute, and the Physician Self-Referral Law all carry stiff penalties for violators. In some cases, you may also be subject to jail time and exclusion from the Medicare and Medicaid programs. Exclusion from the Medicare and Medicaid programs means the government will not pay you or your employer for any items or services you furnish, order, or prescribe. Let's look at these laws and how they affect how you do your job. The False Claims Act is a federal law that protects the government from being billed for false or fraudulent claims. It is illegal for you to submit claims for payment under Medicare or Medicaid that you know or should know are false or fraudulent. If you document that you provided services to a patient and those services are billed to the government and paid for by the government, but you never actually provided those services to that patient, a false claim has been submitted to the government. This may require repaying the claim to the government and may also result in significant fines. The Federal False Claims Act provides that any person who knowingly presents or causes to be presented a false or fraudulent claim for payment or approval, or knowingly makes, uses, or causes to be made or used a false record or statement to submit a false or fraudulent claim, is liable to the United States government for a civil penalty between $5,500 and $11,000, plus 3 times the amount of damages caused by the act of that person. The terms knowing and knowingly mean that a person has actual knowledge the information is false, acts in deliberate ignorance of the truth or falseness of the information, or acts in reckless disregard to the truth or falseness of the information. No proof of specific intent to defraud is required. The False Claims Act makes it illegal to submit false or fraudulent claims for payment to Medicare or Medicaid. Claims may be false if the service is not rendered to the patient, is provided but already covered under another claim, is miscoded, is not supported by the medical record. For example, billing for continuous care when it is documented that the patient is sitting up having dinner with his family, or documentation that says the same thing every day and shows no decline or acuity. For False Claims Act violations, Kindred can be fined up to 3 times the program's loss, plus $11,000 per claim. And fines add up quickly because each claim can be a separate ground for liability. Kindred is committed to accurate billing and preventing false claims. If you suspect fraudulent behavior has occurred, you should immediately contact your supervisor, the facility or agency administrator or executive director, the support center, or the compliance hotline at 800-359-7412. You may remain anonymous when contacting the compliance hotline. You cannot be retaliated against for reporting your concerns. If you feel as though you have been retaliated against for reporting, you should report this to the compliance hotline. All concerns of retaliation will be reviewed and resolved by company policy. You have the legal right to file what is called a qui tam lawsuit if you become aware that Kindred has submitted claims for reimbursement to Medicare or Medicaid or any other government programs in violation of the False Claims Act. In a qui tam lawsuit, an employee or relator files a case alleging a violation of the False Claims Act. If the relator's lawsuit is successful, the relator may collect a portion of the recovery. Kindred will not block any employee from filing a qui tam lawsuit through threats of retaliation or any other means. All employees are encouraged to report and attempt to resolve suspected False Claims Act violations through internal procedures, such as the compliance hotline, prior to filing a lawsuit. You are a vital part of the effort to prevent, detect, and report Medicare non-compliance, as well as possible fraud, waste, and abuse. You have a duty to the Medicare program to report any violations of laws of which you may be aware. What is fraud? Fraud is a false statement that is made or submitted with knowledge that the statement is false and could result in some undue benefit. These false statements could be verbal or written. An example of fraud would be a therapist documenting minutes of therapy services that are not provided, or documenting a home care visit to a patient that did not occur. What is waste and abuse? Waste means specific overuse of services or causes of unnecessary costs. Abuse refers to general practices that are inconsistent with sound business, financial, or medical practices that may cause unnecessary costs to the healthcare system. Unlike fraud, the provider has not knowingly and/or intentionally misrepresented facts to obtain payment. Here are some measures you can take to prevent fraud, waste, and abuse. Ensure you coordinate with other payers. Ensure your documentation is both accurate and timely. Ensure that the billing codes are appropriate for the services provided. Verify information provided to you. Be on the lookout for suspicious activity. In addition to the Federal False Claims Act, many states have developed laws to target fraud and abuse in the Medicaid program. You should familiarize yourself with your state's law. Links to laws are available on the compliance website on Connect and also on Kindred.com. Your responsibility is to report any concerns to the Compliance Department or the Compliance Hotline at 800-359-7412. The Compliance Department will investigate all allegations and determine whether the practice is fraud, waste, and abuse. Everyone has an obligation to report a concern and is therefore required to report suspected instances of fraud, waste, and abuse timely or as soon as it is observed. In some industries, it is customary to reward those who refer business to you. Federal law prohibits healthcare companies like Kindred, who receive payments from federal health insurance programs like Medicare and Medicaid, from giving or receiving anything of value in exchange for referrals. Through the Anti-Kickback Statute and the Physician Self-Referral Laws, or Stark Laws, the federal government requires healthcare companies and healthcare employees to refrain from acting in ways that could put into question the motives for any healthcare decision they make. The federal government has identified possible risk areas that you should take into consideration when ensuring you are complying with federal referral laws. These areas of risk include routinely waiving co-insurance or deductible amounts without a good faith determination that the patient is in financial need, offering free goods or goods at below fair market value to induce a referral source to refer patients to your facility, soliciting, accepting, or offering any gift or gratuity of more than nominal value to or from patients, potential referral sources, or anyone else with which Kindred has a business relationship, and soliciting or receiving items of value in exchange for providing a supplier access to patient medical records. The Anti-Kickback Statute imposes criminal and civil monetary penalties on any entity or individual that knowingly and willfully pays, offers to pay, solicits, or receives anything of value for referrals for services payable under federal healthcare programs or for any other business involving any item or service payable under federal healthcare programs. The Anti-Kickback Statute is a two-way street. It is a violation to receive compensation, and it is also a violation to pay anything of value in exchange for referrals. Items of value can take many forms. It is a crime to give or receive or offer to give or receive anything, including cash, trips, discounts, concert or sporting event tickets, golf outings, gift cards, spa treatments, manicures, pedicures, or meals in exchange for referrals or business. Violating the anti-kickback statute can result in jail time, fines, and exclusion from participating in federal healthcare programs, including Medicare and Medicaid. These penalties apply to both the giver and the recipient of the prohibited benefits. In addition to the anti-kickback statute, the Physician Self-Referral Medical Laws, also known as the Stark Law, prohibits a physician from referring Medicare or Medicaid patients for designated health services to any entity with which the physician or any member of the physician's immediate family has a financial relationship. The Stark Law also prohibits the entity from presenting claims for designated health services provided as a result of the prohibited referral. Unlike the anti-kickback statute, it does not matter if you intended to violate the Stark Law, or even if you knew you were violating the Stark Law. Violating the Stark Law can result in fines and exclusion from participating in federal healthcare programs, including Medicare and Medicaid. Also, recall that there are state laws that may also apply when working with federal sources and physicians. Please check with the law department if you have questions. To ensure compliance with the self-referral laws, Kindred requires that all physician contracts include a fair market value analysis to determine compensation. Additionally, all lease agreements with referral sources must include a fair market value analysis that is used to determine rent amounts. If you have questions about this process, please contact the law department. In order to prevent any implication that Kindred is violating federal referral laws, Kindred has developed a gift policy that specifies what type of gifts you may give and receive. Kindred prohibits employees from accepting from any person or entity any gift or entertainment in any amount that exceeds a nominal value. Employees may not accept or solicit gifts from patients in exchange for or as a precondition for receiving care or services. Employees may not accept luncheons from vendors in exchange for information on specific products or services. Giving gift cards, cash or cash equivalents to any external person, such as a physician, case manager, or vendor, for any reason is strictly prohibited. You should contact the law department if you have specific questions regarding gifts. Additionally, any gift that is given to a physician should be tracked on a gift log to ensure that the annual limit is not exceeded. Kindred has developed a gift log that must be used to track gifts given to physicians. The log is available on the Compliance Department website on Connect and should be updated and reviewed on a regular basis. The gift amount limit changes annually for physicians. The limit in 2015 is $392. Let's talk about some acceptable and non-acceptable practices. Kindred policy does not prevent you from providing education about the services your location provides. Kindred policy also does not prevent you from providing a modest meal to those attending an educational session or a business meeting. Kindred policy allows you to give a holiday basket to a location or referral source as long as the basket is to be shared among the staff and is not in exchange for referrals. Stark Law prohibits exceeding an annual amount for gifts to physicians. The amount in 2015 is $392. Here are some practices that are not allowable under Kindred policy and could violate referral laws. Location provides a gift certificate to case managers or a referring location. A gift certificate is a cash equivalent, and case managers control referrals. Manicures, pedicures paid to case managers are prohibited because case managers are part of the referral process. A vendor is not allowed to supply staff with lunch, as this could be construed as an inducement for a product. Case management departments generally have control with the admission and discharge process. Therefore, gifts, luncheons to them are not acceptable. Gift cards are strictly prohibited. Nominal gift cards are routinely given to a hospital's case management department. Is this a violation of Kindred's policy? Yes, it is. Cash or cash equivalents cannot be given to a case management department since they are a referral source. Additionally, the giving of gift cards to anyone external to Kindred is strictly prohibited. A clinical liaison drops off pastries and donuts every Friday to a physician's office. The pastries are nominal in value, between $10 to $20, and there are 4 physicians in the office. Is this acceptable? Given that the value of the pastries or donuts is nominal, the gift is acceptable. However, the value of the gift must be logged on the physician gift log and cannot exceed the annual amount. Additionally, the total dollar value of the pastries is allocated to each physician. The amount is not divided by 4. In the next example, a hospice home health employee gives a fruit basket to a case management department of the hospital for Christmas. Is this a violation of Kindred's gift policy? Maybe. This is a violation of the Kindred gift policy if it is in exchange for referrals. It is unacceptable to give a gift, even a gift of nominal value, to a case management department or a referral source in exchange for referrals. If you give a gift basket to a case management department of one hospital as a holiday gift, you should be giving an equal valued holiday basket to other hospitals' case management departments or other departments. If you do not comply with the Kindred gift policy, the gift must be immediately returned and the expense will not be reimbursed. Disciplinary action will be taken per the Code of Conduct and the Employee Handbook. At Kindred, we help patients and families through difficult periods in their lives. Patients or families sometimes wish to show their appreciation for a job well done by giving gifts to their caregivers. These gestures are well-intentioned, but accepting these gifts could have unintended consequences. Accepting gifts from patients could give the impression that you are favoring the patient or giving special treatment. It could also give the impression that you are taking advantage of the patient. Kindred policy prohibits receiving cash or cash equivalents from patients or family members. Kindred policy also prohibits accepting gifts and tips from a patient regardless of amount. If a patient or family member offers you a gift, you should thank them for their generosity and politely decline the gift, citing company policy. For similar reasons, you should never request or accept personal loans from patients or their families. In some states, accepting loans from patients is against the law. The government has imposed strict limits on giving gifts to Medicare beneficiaries. It is acceptable to give gifts valued under $10 to a Medicare beneficiary. The total value of all gifts given to an individual may not exceed $50 per year. Now that we have talked about business and financial practices, let's talk about privacy and patient care. Under the Health Insurance Portability and Accountability Act, or HIPAA, Kindred must protect the privacy and security of patient information. This means you are responsible for preventing protected health information, or PHI, from being acquired or accessed by unauthorized individuals. What is protected health information, or PHI? Protected health information is any information received by Kindred that relates to a patient's past, present, or future physical or mental condition, or relates to a patient's payment for services. The information must also identify or can reasonably be used to identify the patient. Identifiers are not limited to a patient's name. An identifier can be a patient's initials, date of birth, date of admission, photograph, room number, medical record number, social security number, email address, telephone number, or any other unique identifying number, characteristic, or code. It can also be information related to a patient's family members or employer. This is not a full list of everything that can be used to identify a patient. Please consult with a supervisor or the compliance department if you are unsure if information is identifiable. HIPAA allows you only to access minimum necessary protected health information. This means you should only view the patient information you need to do your job. If you are not caring for a patient or a patient is no longer being treated at Kindred, you probably do not need access to the patient's PHI. Accessing more than the minimum necessary is a HIPAA violation. Many employees use company-owned and personally owned devices, such as smartphones, tablets, and other handheld mobile devices to access Kindred's information systems, including Kindred Email. If you use a personal device for Kindred Email, Kindred requires your device to be password protected. In addition, Kindred takes additional measures to secure your Kindred email, including requiring installation of special software to encrypt your Kindred email and allowing Kindred to remotely delete the email in the event your device is lost or stolen. If any device used to access Kindred email is lost or stolen, you must promptly contact the compliance hotline at 800-359-7412. In order to prevent devices from being lost or stolen, you should take common sense measures to ensure the devices are secure. You should not leave your device unattended in a public area, even if it is just for a moment. You should also keep devices secured when transporting them. Electronic devices should not be left in plain sight in an unattended vehicle. Place the device in your vehicle's trunk. If your vehicle does not have a trunk, store the device out of sight. In addition, electronics and patient paperwork should never be left in a vehicle overnight, even if the vehicle is locked. Let's look at an example of a patient privacy issue. James is a case manager. He is working to place a patient in another facility that can provide an appropriate level of care. He faxes the patient's information to the referring facility using a Kindred fax cover sheet, but he accidentally misdials the fax number. He receives a call an hour later from an employee at a local business indicating that the fax has been received. How should James handle the situation? What should you do if you discover that someone has received a fax in error? First, while on the phone with the person, verify what information was received and ask for their name and contact information in case there are further questions. If you know what was sent, you should also ask the person to shred the information he or she received and document whether or not they agreed to shred the information. After the call, you should immediately report the violation to your privacy and security contact and the compliance hotline. Collect documents that could help in the investigation, such as a copy of what was disclosed, the fax cover sheet, and the fax recipient log. You should also assist with the investigation if asked. There are steps you can take to help prevent misdialed faxes. First, always use a fax cover sheet. This will help you with identifying the correct fax number to be used. You should also double-check the fax number that you enter before pressing send to make sure there are no dialing errors. Pre-program frequently used fax numbers to avoid misdialing. You should periodically check these numbers to make sure none of the numbers have changed, and you should delete any numbers that are no longer used. Finally, scan and email information whenever possible. Text messaging is not a secure communication path and can pose significant risks to the security of PHI if transmitted by text. Sending or receiving texts containing PHI is strictly prohibited and is a violation of Kindred policy. If you are being asked to transmit PHI through text messaging, you should refer to Kindred policy. If the individual continues to request that you send PHI by text, tell your facility administrator or contact the compliance hotline at 800-359-7412. Social media is another area where health information is at risk. It is not acceptable to post pictures of patients or post any other patient information to Facebook, Twitter, YouTube, or any other website where unauthorized individuals could view it. Setting your Facebook profile or Twitter account to private does not mean that you may post patient information. Failure to follow Kindred's policy can lead to HIPAA breaches and may include disciplinary action up to and including termination of employment. Passwords are one of the best ways to protect PHI stored on computers. But to be effective, the passwords themselves should be safeguarded. Do not share passwords with anyone. If for some reason you need emergency access or technical assistance, simply follow corporate policies. Be sure you commit your password to memory and never use other employees' usernames and passwords. Do not write account names and passwords on sticky notes or paper and leave them where others can see them. Only open attachments from known senders. Save PHI only to encrypted and password-protected media. Do not save documents containing PHI to home computers. Do not disable antivirus software on Kindred computers. Report any unusual computer or tablet activity to the help desk. Some common HIPAA violations are misdialing fax numbers, providing a patient's chart to the wrong person, lost or stolen phones, computers, or tablets containing PHI, lost or stolen unencrypted flash drives, paperwork containing PHI that is lost or stolen from a car or briefcase, reviewing information on patients when you are not authorized to receive the information. When patient information is disclosed in a manner that is not permitted under HIPAA, Kindred may be required to report the disclosure to the state or federal government and to the affected patients. Regardless of how minor you believe a HIPAA violation to be, all HIPAA violations must be reported immediately to the Compliance Department or to the Compliance Hotline at 800-359-7412. Time frames for reporting are very short and must be followed. As part of the Kindred Compliance Program, special attention should be paid to ensure that our employees provide a high level of care. Our job is to ensure that our patients receive services to help them achieve their highest possible physical and mental well-being. In order to ensure that quality care is provided, Kindred has developed policies and procedures to guide you through the key components of good patient care. Some particular areas of focus include pain management, pressure ulcer care, proper medication administration, and meeting appropriate dietary needs. These policies serve as a guidance for delivering good care and should be reviewed periodically and when the policies change or are updated. An additional quality of care area is abuse prevention. In addition to the policies and procedures that have been established for abuse prevention and recognition, there are other avenues, such as the open door policy and the compliance hotline, that can be utilized to bring forth potential abuse concerns. It is important to remember that there can be additional state and federal requirements for reporting abuse. For example, the Elder Justice Act requires employees to report instances where there is a reasonable suspicion that a crime has been committed against a person receiving care at Kindred. Check your division's policies and procedures to see whether or not you are required to report such issues and whether this regulation is applicable to your division. The Elder Justice Act is a federal law that applies to Kindred nursing facilities and hospice services provided at a nursing facility. Under the Elder Justice Act, Kindred must report any reasonable suspicion of a crime committed against any individual who is a resident of or is receiving care from a long-term care facility, including hospice services provided at a long-term care facility. The suspected crime must be reported to one or more local law enforcement agencies and to the Secretary of the Department of Health and Human Services or to the agency designated by the Secretary to receive such reports. Time frames for reporting are short. If you suspect a crime has been committed against a resident, you should immediately notify your executive director. Failure to report suspected crimes can subject a provider to civil monetary penalties up to $200,000 and may lead to exclusion from participation in federal healthcare programs. If failure to report a crime results in further injury to the victim of the crime or results in harm to another individual, the civil monetary penalty may be increased to $300,000. The best way to demonstrate good quality of care is through accurate and appropriate documentation in the medical record for each patient. The medical record serves many purposes, and it is important that the information contained in the medical record be truthful and accurate for each patient. All caregiver documentation, care plans, treatment plans, medication administration records, treatment records, and therapy documentation records must contain truthful information about the patient's care and condition. Falsification of records constitutes a federal and state crime. It is important to identify some examples of falsification of records or improper documentation. One example of record falsification would be signing off that you have completed a treatment or given a medication when you have not. Another example would be to indicate that you have provided therapy treatments and improperly recorded the amount of time spent with a patient. Documenting a home care visit that did not occur is improper. It is Kindred's expectation that these kinds of behaviors be immediately reported to the Compliance Department directly, to the Compliance Hotline at 800-359-7412, or to a manager. It is the manager's responsibility to ensure that the Compliance Department is notified timely. It is unacceptable to overlook this kind of wrongdoing. Billing is another area where there is a high risk for fraudulent behavior and non-compliance with Kindred policy. The following practices are considered fraudulent and are not acceptable under Kindred policy. billing for items or services without appropriate certifications. Check with division-specific policies to ensure requirements are met. Billing for items or services not rendered or provided as claimed. Submitting claims for equipment, medical supplies, and services that are not medically necessary. Duplicating billing. Failing to identify and refund credit balances. Submitting claims to Medicare for patients who are not eligible for coverage. Upcoding the level of service provided. Forging physician or beneficiary signatures. Failing to maintain documentation to establish that services were ordered and performed, and filing false cost reports. Billing for minutes of therapy services that have not been provided. Billing for a home visit for a home health patient that has not occurred. Billing for services on a home health patient that does not meet homebound status. Any instances in which the above actions could have occurred or have in fact occurred must be reported to the Compliance Hotline at 800-359-7412. Retaliation for reporting to the hotline will not be tolerated. In addition to documenting accurately, we must also ensure documentation is kept as required by law. Kindred maintains a document management policy to ensure that documentation, both electronic and physical, is maintained as required by law. You should familiarize yourself with these retention requirements to ensure all laws are being followed. The document management policy is available on Connect under Global, then Policy and Procedures. Another important part of Kindred's compliance program is employee screening. Kindred is required by law to investigate the backgrounds of employees. All Kindred facilities must verify required licenses and certifications are in order for any current or potential employee. Thorough background investigations and reference checks must be completed on all potential employees. In addition to the required background check and licensing review, all employees are screened to ensure there are no excluded persons working for Kindred. The Office of the Inspector General's list of excluded individuals and the General Service Administration's System for Award Management lists those individuals and contractors who are not permitted to bill the government for services provided. Additionally, employees are not permitted to work if they have been excluded under any state exclusion lists. Because Kindred accepts payment from federal healthcare programs, Kindred does not permit any excluded individuals or contractors to provide services on Kindred's behalf. As an employee of or contractor for Kindred, you must certify that you have not been convicted of any offense that would preclude you from being employed by a healthcare provider. You must also certify that you have not been excluded from participation in any federal or state healthcare program. If your status changes while you are an employee or a contractor for Kindred, you are required to immediately notify your supervisor or the facility administrator. The Compliance Department performs monthly OIG SAM screens on all current officers, employees, and contracted physicians and entities. Additionally, the Compliance Department performs monthly state exclusion screens. It is the responsibility of a facility or agency to ensure all required screens are completed before allowing a new employee to work. Information on conducting screens can be found on the Compliance Department website. Kindred must also screen potential vendors to ensure they are not excluded from participating in federal programs. It is the responsibility of each facility or agency to screen every vendor for state and federal exclusions before signing a contract with the vendor. Ongoing screens are conducted by the Compliance Department. To run a state exclusion screen, you should go to Global, Compliance, OIG GSA. Links are available for those states that maintain exclusions. If you need assistance running a state exclusion, please contact the Compliance Department at 800-545-0749. Based on your role at Kindred, you may be required to maintain a license or a certification as part of your job. It is your responsibility as an employee to make sure that you are meeting the requirements of your license to keep it active and in good standing. It is also your responsibility to ensure that it is renewed before expiration. If at any time there is a pending board action against your license, or your license is disciplined, sanctioned, revoked, or suspended, you must immediately notify your supervisor. The next area of discussion is the Conflict of Interest Policy 20.0. An actual or potential conflict of interest occurs when an employee is in a position to influence a decision that may result in a gain for an employee or for an outside party with whom the employee has a relationship. Some examples of potential conflicts of interest include 1. Accepting or giving gifts to and/or from any person doing business with Kindred, including patient and referral sources. 2. A direct reporting relationship to immediate family. 3. Use of Kindred information for personal gain. 4. Possessing a financial interest in an outside party that does business or competes with Kindred. 5. Accepting positions or employment as a director, officer, independent contractor, employee, or consultant for compensation from anyone doing business with or competing with Kindred. For Kindred's compliance program to be effective, Kindred conducts ongoing monitoring and evaluation of the program. One effective tool to assess the compliance program is performing regular, periodic compliance audits by members of the Risk and Compliance Department, other Kindred departments, or external experts. These audits focus on day-to-day operations, as well as how well Kindred is complying with rules governing claims development, billing and cost reports, compliance with Medicare and Medicaid requirements, and other key components of the Kindred compliance program. Kindred's auditing and monitoring consists of on-site visits and off-site reviews of facilities, testing the billing and claims reimbursement staff on its knowledge of program requirements and claims and billing criteria, reviewing medical records to ensure support of medical necessity, examining the complaint and grievance logs and investigative files, reviewing past surveys to determine if follow-up actions have been completed, checking personnel records to determine whether previously disciplined staff members are now conforming to policy, validation of licensure and certification of appropriate staff, analyzing past survey reports for patterns of deficiencies, and reviewing physician gift logs. Each facility and location must self-audit as part of the compliance program. Whenever an overpayment is identified, whether through a compliance audit or by operations, Kindred will report and refund that overpayment. Overpayments must be refunded promptly in order to ensure compliance with the law. If you identify an overpayment, you should immediately notify the compliance department. In order for Kindred's compliance program to be effective, Kindred must make sure that employees are able to communicate their concerns. Your supervisor plays a key role in responding to your concerns, and he or she can serve as your first line of communication. However, sometimes you may not feel comfortable taking your concern to your supervisor. In order to make sure you are able to make your concerns known, Kindred has established a compliance hotline. The hotline is not a substitute for the open door policy, which should be used to express job-related concerns and have them addressed by management. The compliance hotline is designed to be used to report potential or actual violations of laws, regulations, policies, and procedures, or the Code of Conduct. The hotline can be reached at 800-359-7412. The hotline is staffed by an outside vendor and is available to all employees, vendors, patients, and family members 24 hours a day, 7 days a week. Those calling the hotline may choose to remain anonymous, and calls are not recorded. If you wish to remain anonymous, the compliance department will take all available measures to ensure that your anonymity is protected. Calls to the hotline are documented and investigated promptly. Kindred policy prohibits retaliation against anyone for filing a good faith complaint or concern with the compliance hotline. Any supervisor, manager, or employee who conducts or condones retribution, retaliation, or harassment of an employee who contacts the hotline will be subject to disciplinary action, up to and including termination of employment. Individuals who intentionally misuse the compliance hotline may also be subject to disciplinary action, up to and including termination of employment. The best way for you to learn about the policies and procedures requirements and your responsibilities related to the compliance program is to review the policies and procedures on Connect. To access Kindred's compliance policies, go to Global, Compliance, Policies and Procedures. If you have questions, contact information for all compliance personnel is available on the site. Reporting your concerns is an important part of the effectiveness of Kindred's compliance program. You are required to report any activities that could be illegal, unethical, or that violate the Code of Conduct, the Employee Handbook, or any policy or procedure. It is not acceptable to overlook actual or potential wrongdoing. Some examples of issues that should be reported include poor quality patient care, billing concerns, falsification of documents, licensure credentialing issues, conflicts of interest, HIPAA violations, alcohol, drug abuse, theft, health or safety violations, discrimination, and harassment. The hospice industry has come under increased scrutiny from federal and state audit agencies. Several years ago, before it became a part of Gentiva, Odyssey Healthcare was examined by the federal government. After a review of medical records for Odyssey patients who received continuous care services during the period of January 1, 2006 through January 22, 2009, the government alleged that Odyssey provided these services to patients who were not eligible for them. As a result, February 17, 2012, Gentiva announced in a press release that Odyssey Hospice had entered into a 5-year Corporate Integrity Agreement, CIA, with the Office of the Inspector General of the Department of Health and Human Services, and a settlement agreement with the Department of Justice. Under the terms of the CIA, the company must do several things, including education directed to employees of the hospice division, annual internal and external audits, and annual reports on compliance with the CIA requirements. These requirements will apply to everyone who works in the hospice division through the CIA period. The education requirements are role-based and will be required annually during the CIA enforcement period. Gentiva has strengthened its compliance program and is focused on exceeding industry standards to ensure we operate in accordance with all applicable laws and regulations. Compliance with Medicare regulations and federal and state laws and regulations is critical to all of us, and we should all strive to adhere to the highest levels of ethical, compliant behavior for our company and for our patients. Even as we proceed with meeting this challenge, the Compliance Department wants to take this opportunity to thank our thousands of clinicians and the people that support them for providing great care, compassion, and extraordinary service to our patients and families each and every day. As always, we are committed to working closely with all of you to be sure we continue to provide the value-added, cost-effective services that only home health and hospice can offer. The purpose of the company's corporate compliance program is to prevent and detect any criminal, fraudulent, as well as other unethical and improper conduct, and to take appropriate corrective actions upon any detection of any such conduct. The program is intended to meet or exceed the requirements of the federal sentencing guidelines created by the U.S. Sentencing Commission pursuant to the Sentencing Reform Act of 1984. Some of the activities the program is intended to prevent include billing for excessive services not medically necessary or appropriate, billing for services not rendered, failing to comply with government and other payer requirements, including billing Medicare for hospice patients who do not meet eligibility requirements, submission of Medicare cost reports claiming expenses unrelated to patient care, or failing to identify related parties with whom business is conducted, and failure to obtain any required prior authorizations, or to comply with claim submissions requirements, upcoding the level of care, or otherwise entering false or misleading information on assessments, orders, clinical notes, or other documents for the purpose of obtaining excessive or disallowed payments, such as general inpatient level of care or continuous care, the use of unlicensed or untrained staff, falsified plans of care, forged signatures, falsification of clinical documents and reports for the purpose of payment or licensure certification, including, but not limited to, documentation of services not provided, backdating or falsifying dates of services, and falsifying the condition and status of a patient. Failure to comply with applicable rules and regulations related to the protection and appropriate use of patient-identifiable health information. Intentionally billing 2 or more payers for the same services, resulting in duplicate payment, double dipping, kickbacks and improper relationships with referral sources, routine waivers of copayments, unlawful harassment or discrimination, wage and hour violations, failing to meet other legal requirements. The company and every employee of the company is responsible for adherence to the corporate compliance program and all applicable legal requirements. Make sure that you have read and understood the program. Any questions regarding the program may be directed to the Chief Compliance Officer. We are all members of the compliance team. Let's review Gentiva's efforts to ensure our company stays in compliance with and not in violation of the False Claims Act. Our technical denials continue to be a large percentage of the loss incurred by the hospice division. The work was done, care was provided, but we neglected to cross our T's and dot our I's. If the consent is not completed correctly by the patient or power of attorney, we do not have a legitimate consent and cannot bill. Likewise, if it is not dated by the beneficiary or POA, it is also questionable. The staff completing consent forms should be thoroughly trained. We need your help to turn this around. The top 3 reasons that claims are held: Certificate of Terminal Illness or CTI, General Inpatient or GIP, Medical Necessity. Problems with the CTI included the benefit period being blank or dates added after the physician had signed. The physician had not signed and/or dated the verbal certification was obtained by one doctor, however another doctor signed the certification. Problems with the general inpatient level of care billing included no physician order obtained for GIP, no documentation of why the patient needed GIP, no documentation of any interventions by the hospice staff to control the symptoms prior to the patient being sent to an inpatient unit, no documentation of symptom management or the need for GIP while the patient was considered GIP, no plan of care for the symptom, or no change when the condition of the patient changed. Problems with the medical necessity included no documentation of hospice eligibility, no indication that a higher level of care was required. Does your documentation reflect the need for hospice care? Is it clear, precise, and does it include all your activities? Does it clearly tell the story of your patient's last chapter? So, how does Gentiva support the government efforts? A sophisticated hospice provider is expected to fully know and appreciate the Medicare statute, the definition of terminally ill, and the local coverage determinations that set out medical criteria for determining whether individuals with certain diagnoses have a prognosis of 6 months or less to live. The purpose of the Medicare requirements is to ensure that the limited Medicare funds are properly spent on services actually needed by Medicare beneficiaries. Hospice has a duty to deal honestly with the government. Here are some actions you can take to improve our culture of compliance. Continue to provide outstanding care. Provide care in the most compliant manner possible. Remember the 3 vital processes. 1. Document all aspects of care explicitly, clear, legible, concise, timely. 2. Meet all education and training deadlines. 3. Ensure that all claims that cleared for billing comply with all Medicare requirements. Follow correct billing processes. If in doubt, ask. Lead and act in a fair, equitable, consistent, and respectful manner in an atmosphere of trust and accountability. Remember, at the same time, we support you, and we are proud of the work you do and to have you as colleagues. In conclusion, Kindred's compliance program has developed and implemented internal controls and procedures that promote compliance with statutes and regulations of the federal healthcare programs, including the Anti-Kickback Statute, Stark Law, and False Claims Act. You are responsible for reading and following Kindred's Code of Conduct and knowing your division's policies regarding billing, referrals, and abuse reporting. You are also responsible for taking appropriate steps to make sure protected health information is kept private. Any potential violation of Kindred's Code of Conduct or policy and procedure should be reported to the Compliance Hotline at 800-359-7412. You may remain anonymous if you do not wish to identify yourself, and you will not be retaliated against for filing a report. You are important to Kindred's compliance efforts. If you have questions, please ask your supervisor or contact a compliance department representative. Here are some things that you will need to report to compliance. Providing services that are not medically necessary. Billing for services not rendered. Upcoding, billing or placing a patient on general inpatient, respite, or continuous care when it is not needed or warranted. Use of unlicensed or untrained staff. Falsified plans of care. Forged signatures. Kickbacks. Failing to meet other legal requirements. Anything questionable. Anything you would be uncomfortable with seeing on the front page of your newspaper or on the 11 o'clock news. If you need guidance, suspect illegal or unethical activities, call the Compliance Hotline at 800-359-7412. It is your obligation, and it is also your right. This concludes the electronic portion of the General Compliance Training. To close out this presentation, please click on the red X in the upper right corner. Make sure you see your score and completion. Also, you must complete and sign the Code of Conduct attestation. Thank you for your participation.